There are a couple of reasons why an antibiotic might not be the way forward when you go to see your GP with a fever. Let's discuss this. An antibiotic might only work if your infection is bacterial. Majority of common colds and flus are viral infections. In those cases, antibiotic might not be effective. Having said that, there are some cases where usage of antibiotics is quite crucial in terms of treatment. For example, if you have a urine infection, if both your ears are infected with severe and you're having severe fever, if you have tonsillitis that is sort of stopping you from swallowing with severe pain in your throat, to name a few. When you have been unwell for a few days and when you have severe fever and feel really tired and fatigued, it is quite common for people to think that an antibiotic might do the job, but in most cases it will not be that effective. There are a few reasons why GPs or healthcare professionals can be a bit reluctant in prescribing antibiotics. Of course, when your kids are unwell back to back, it is quite frustrating and it is really hard on parents or carers, and it is very normal for parents to think that the antibiotic might do the job, but in majority of the cases, if you just give them some time, they will get better. I always say that the parents would know their own child. So obviously if you're concerned, if there is a decreased number of wet nappies, or if they're not their usual self, or if they're not passing, if it's an older child, obviously not passing enough urine, if they're lethargic, if they're not eating well, if they look dehydrated, obviously bring them to us. So if you take antibiotics for minor bacterial infection, for example, if you have a mild chest infection, or if one of your ear is infected, if you feel a bit unwell and if you give you antibiotics, what would happen is you're basically stopping your body's immune system in order to respond to that infection. So you're sort of preventing your own body fighting that infection if you are giving the antibiotics early. First thing. The second thing is, sometimes when you've had a viral infection for a couple of days and you've had an antibiotics, for example, 7 or 8 days into the infective period, when you take the antibiotics and when you feel better, it gives like a false impression that you got better because you took the antibiotics. In reality, it might just be your body fighting and producing antibodies and getting you better. Of course, when your kids are unwell back to back, it is quite frustrating and it is really hard on parents or carers, and it is very normal for parents to think that the antibiotic might do the job, but in majority of the cases, if you just give them some time, they will get better. I always